Heart disease is the leading cause of death for Missourians. As Meg Judy reports, the University of Missouri Healthcare is helping patients catch potential cardiovascular issues before they become a problem.
A lot of it comes from the garden, tomatoes and various vegetables.
Larry Sheppers doesn't just eat vegetables, he grows them.
We're getting ready to till it up again and start a new garden this year.
However, during the last harvest, Larry felt different.
When I was tilling the garden, I didn't have the energy that I had in previous years.
Larry went to MU Healthcare and took a Love Your Heart cardiac screening.
This is a scan that helps us to look at the blood supply to the heart and tell us if there are blockages beginning to form that could be a risk for a heart attack.
Larry received a laboratory analysis to evaluate cholesterol and risk for developing diabetes. He also got a cardiac calcium score screening using a CT scan to check for calcium deposits in the walls of his heart's arteries.
Larry's heart scan showed significant elevation of coronary artery calcium. When we saw Larry's high risk score, we knew that we wanted to see him very soon after.
Well, the doctor said that's the highest number that I've ever seen. That got my attention right away.
Larry needed to have a coronary angiogram where we actually went in with catheters and contrast dye and imaged the arteries, and Larry ended up needing to have a stent put into his right coronary artery to open up a 90% blockage.
Thanks to MU Healthcare doctors, Larry was back to normal only a month after his screening.
He was exactly who the Love Your Heart cardiac screening was designed for. Larry was someone who, like most of us, don't have symptoms until an event happens.
You should consider a Love Your Heart cardiac screening if you have any of the following: high blood pressure or cholesterol, a family history of heart disease, type 2 diabetes, a history of smoking.
Love Your Heart cardiac screening is a scan that you really only need to have maybe about every 8 to 10 years, maybe only once in your lifetime, depending on the results.
For University of Missouri Healthcare, I'm Meg Judy.